Good morning, everyone. Um, it's my pleasure to be with you today, and I was privileged as to be one of the medical students for two of my great teachers who are models for me, Dr. Qasim and Dr. Najah. And I'd like to thank you to accept my request to do such presentation in your great hospital. And I would like also to thank the Smile Initiative Group, which is an NGO group supporting children with cancer in Bahrain and their families. I'm being a volunteer member with them, and also I would like to thank them. Supposed to be somebody presenting from them here, but maybe not yet arrived, to give me this beautiful colored template of presentation. So my talk today is about children are not small adults. Be aware of childhood cancer. And this is because September is the month of awareness about childhood cancer. And we thought to do such activities to cover many of the hospitals here at the level of secondary and primary as well. So children are not small adults, and that's true, because they have different characters that can affect many aspects about this disease. They have a different and unique exposures. They have a dynamic developmental physiology, longer life expectancy, and they are also politically powerless. And this will affect the concern about different aspects about childhood cancer, from presentation, biology, diagnosis, and also the long-term outcome, and also the support that they got for their disease. Through the coming 40 minutes, I'm going to present at least 16 facts about childhood cancer to cover different aspects about it. I will start my presentation by asking you that question for any volunteer to answer. What is the color of childhood cancer ribbon? It's a gold. It's not yellow. That's true. And gold was chosen because, you know, gold is a very precious metal. And that's so our children are very, very precious things in our life. So the first fact about childhood cancer, saying that childhood cancer is a rare disease. And when we define a rare disease, that means it affects less than 5 persons in any 10,000 of a population. And that's applied for childhood cancer. It represents only, if we saw in this cartoon, this is all the ages of cancer, and represent only about less than 6% of those diagnosed with cancer. And among that group also, if we are talking about children below the age of 14 years, and among that, 50% of this children are below the age of 5 years. And this is important because, you know, this preschool age children, they cannot express or they cannot present their complaints or their problem. So they depend on the awareness of the caregivers who are the parents, or any doctors who can see them for other routine things. If we go to numbers and compare pediatric to adults, so every year there is at least 18 million cancer cases diagnosed per year for adults, with an incidence almost close to 3,000 per million. In children, there is at least 400,000 new cancer cases diagnosed in children and adolescents, if we are including them below the age of 18 years. With an incidence 50 to 100 per million for age below 14, and it's doubled for when they are talking about the adolescent. The second fact saying that childhood cancer is though it's rare, but it's a common cause of death. And this is maybe something similar to adult. So it's coming actually in the second cause of deaths in children after accidents and maybe wars. And in adults, it's coming the second cause of death after cardiovascular disease. And every day, there is at least reported 240 children die because of cancer in the world, with an estimated of 90,000 deaths per year. Third fact saying these statistics, they don't tell the whole story. Unfortunately, in countries with, they call it the low income or middle income countries, which are coming in the color of red, orange, or yellow, the records of this, there is no accurate records about these cases, and even many children may die even without diagnosis. So the current numbers, maybe it's not representing the real numbers of cancers in children. Fact number 4, saying that the majority of children with cancer are coming from low income and middle income countries. And that's almost like 80%. And this is important also when we talk about the overall survivor over the world. And also we said that there is also no accurate records about that. Childhood cancer is not one disease, and it can grow in any organ or cell. As you know, that cancer is a disease of cells. So any cell in the body can be a site of for cancer. From blood to every organ, extending from the brain down to the all bones, muscles, and organs. And if we talk more about it in percentage. So for children below the age of 14 years, we know that hematologic malignancy, which are leukemia and lymphoma, are the most common, almost represent 40%, followed by CNS tumors. And then what we call it a group of embryonal tumors, including the neuroblastoma, retinoblastoma, renal, and hepatoblastoma. And then other tumors coming. If we look at this here, at the green part, which is represented the carcinoma and melanoma, which are the cancers which usually happen in adults, it is only represent very small percentage. If we go to adolescent, because many centers in the world, adolescent also will be under the cover of pediatrics care. So 15 to 19 years, this percentage will be changed. So hematologic malignancy coming less by 10%, still CNS is common, but we can see that embryonal tumors coming less and more of germ cell tumor, and the adult type of cancers will be increasing. Another fact saying that even neonates and infants can get cancers. If we go to that, so they get maybe different types of cancers, more of embryonal. So leukemia, which is the most common usually in general, but here neuroblastoma, which is one type of embryonal tumor, becoming more, though it is many cases of this type of disease as of low risk, which can maybe regress continuously even. And then also we have the other embryonal renal tumors like worms, hepatoblastoma, and retinoblastoma as well. In infant, retinoblastoma will be increasing, neuroblastoma coming less, but still the embryonal are the most common among this group. Childhood cancer is biologically different from adult, and this is reflected if we see the types of cancer happening on them. So this again represents the children below the age of 14. This is the hematologic malignancy. As we grow elder, this percentage coming less to be less than maybe 20% among adults who are aged more than 30 years. But we can see that the green part, which is the carcinomas, are getting more and becoming the major or the most common cancer in adult. And that's include, as you know, breast cancer, thyroid, lung, colon, and prostate, and others. If we talk about the causes of cancer, so it is actually, it is still unclear why children get cancer in most of cases. And we know in adults, there is always different or interference between environmental factors, genetics, and maybe some percentage of patients we're not sure why they got cancer. And among the environment factors, we know all that smoking is one of the major cause because it contains more than 80 carcinogens, unhealthy lifestyle, including unhealthy diet, obesity, less activity, and alcohol consumptions, in addition to chemical exposure and pollutions, viruses well known about hepatitis B, C, HIV, papilloma virus, and maybe also ABV, ionizing radiation, a lot of exposure to it, either as sort part from radiation or from scanning, like CT scan and X-ray, and the ultraviolet radiation and its association with skin cancer. So in adult, actually, almost 50% of adult cancers are related to environmental factor. But when we come to children, The percentage is, though still environmental factors can play, but its role is coming less. Though with time, actually with more research and happening, more and more relations has been found, and the percentage maybe is getting bigger. There is also a genetic causes which can cause at less than 10% of childhood cancer. And this one can be summarized on this table. So we have the familial neoplastic syndrome, like familial thromboblastoma, familial worms. Actually, last year we got 3 patients with the same family, the mother and her brother, the uncle. They had Wilms tumor when they were a child, and then the mother got a child with Wilms tumor, and we found that they have this familial Wilms tumor. And Low-Romani syndrome is well known to cause many different types in cancer in children as well as in adults. Something unique to children, which is the inherited immune deficiency and also the bone marrow failure syndromes. They are associated with risk of cancer, especially the hematologic cancers. We have different syndromes, like Beckwith-Whitman syndrome, though these are very rare syndromes, but we have seen several cases in Bahrain here. Down syndrome among the chromosomal abnormality, which is very associated with the risk of develop leukemia, especially a sort of type of leukemia called the AML, megakaryoblast leukemia. When we talk about environmental factors and its association with childhood cancer, actually, 2 evidence support that they are playing a role. One of them, that the incidence rate of childhood cancers has increased in recent decades. For example, for leukemia, we have also brain tumors, and also we have all the epithelial neoplasm. And the other evidence that there is variations in the type of cancers and the incidence in different countries, geographic area, and racial and ethnic group. And this suggests that environmental factors may play a role as alone or in combination with genetic predisposition as well. So these factors, as we said, they are playing less extent role in children, but it's very well known that early exposure from the time of preconceptions during pregnancy to and early years of life make these children at risk to develop cancers later. And this also has been explained by what they call it the 2-hit theory, when there is a predisposition and then another factor coming and increase that risk. So with smoking already we talked, but there has been meta-analysis of more than 30 studies showing that parental smoking has caused at least 10% increase in the risk. Ionizing radiation, which came from a study in atomic bomb survivors, the exposure of radiation. That's why one of the things we teach ourselves that we have to minimize using X-ray and CT scan as much as we can. If we expose children to radiation in early life, they will be at risk to develop it within 10 years or during their adolescence as well. Ultraviolet radiation and the association with skin cancer. A recent study from Sweden and Australia showing that there is increasing number of adolescents having skin cancers because of the tendency nowadays to trying to expose to sun to change the color and of their skin. Viruses, and then we have the chemical exposure. And most children, they are exposed to unhealthy levels of air pollution, which is increasing year by year in our environment. And being their body are very sensitive, maybe that will make them more sensitive or risk to develop cancer. And it has been associated with several types of childhood cancer. And these air pollutions are, we are exposing to them through outdoors and indoor. Outdoors, we have all the mobiles, airplanes, we have the cars, and we have the factories, the oil and gases, and we have the natural also source of air pollutions coming from the heated particles from volcanoes and others. And we have also the wars which going on over now. And indoor, we have emissions coming from different sources, from the cleaning and from also the the malls as well as from, and in our country we use a lot of bukhur or what the wood burning as well. All these pollutions, they have a mix, they contain mixtures of chemicals which are known to be carcinogens, which can cause damage for DNA as well as chronic inflammation and increase the risk of cancer. The house dust behaving like a reservoir for these chemicals, and our young kids, even when they are crawling, they can get exposed to these particles through ingestion, inhalation, and skin contact as well. So second question is to you, what is the day of International Childhood Cancer? Though September is a month of childhood cancer awareness, but the day of International Childhood Cancer is 15th of February. It's coming at least almost 11 days after the cancer day, which is 4th of February. Next fact is saying that early symptoms are often non-specific, and this is one of the challenges facing the diagnosis of childhood cancer, that early symptoms could be a symptom of other diseases rather than cancer. And many of these symptoms has been collected and using the acronym child cancer, as we'll see it in the next slides. But we have to emphasize that the presence of these signs and symptoms not necessarily indicate that this child having cancer, but it should alert the parents to seek medical advice as well as physicians to consider cancer among the differential diagnosis, especially that this disease is being a very rare, so people may not keep it in their mind. And there are cases who are patients, children with cancer, also they may be asymptomatic and they may be detected incidentally. And examples of that may be children with Wilms tumor, when they mother may be noticed a mass during bathing of her child, or when the child will be examined for any other reasons or routine during vaccination time, they found that there is a hardness or a mass in the abdomen, and the child is asymptomatic. So collecting these non-specific, or what we call warning signs of cancer, and when using the child cancer acronym. So C for continued unexplained weight loss or poor weight gaining, headache with early morning or vomiting, and not necessarily also to have these symptoms, because could be a start even headache alone. Increase or recurrent pain in any site of the body, the presence of a lump, any site of the body, in the neck, in abdomen, or in the joint. Though it can be explained, especially, for example, lymph nodes, it could be the most common of it is infection, but it could be the first sign of cancer as well. And development of excess bruising and rash. We know children, it's very common to see bruises in their lower limbs, especially when they start walking. But when you find it somewhere else, like in the trunk or the back or in the face, keep in mind that this could be cancer, or it could be a benign hematology problem. Remaining of symptoms foresee constant, frequent, persistent infection or change in the behavior. A for whitish color behind the pupil, and what we call leukocoria. It could be the first sign of retinoblastoma. And N for nausea or persisting vomiting. Constant tiredness or paleness and pallor. And then we have new signs or change in the vision. For example, sudden squint. It could be the first sign of brain tumor, or we having a sort of this swelling with bruises around the eye. This is what we call raccoon eyes, and this is maybe one of this presentation of neuroblastoma, though it is in the abdomen, but when it is also metastasis behind the eye and causing such pressure. The WHO, in association with different societies of child cancer, has been collected all these signs and symptoms in such cartoons to make it easy. And this is for community as well as for medical teams as well. Fact number 10, the childhood, in spite of all the bad news upon people feel sad when they hear about cancer, but in childhood cancer, the good news about it, it is a very curable disease. And if we compare it to adult, in adult, the survivor has been increasing, but probably it reached to not less more than 60% currently. But when we go for cancer survivor, actually currently it reached to above 85%. And in fact, it's in several diseases like Hodgkin lymphoma, Wilms tumor, the survivor even above 90%. and some close to 100% for some cases of worms like early stages and Hodgkin. In spite that there are still some diseases are still low, but over years has been improvement. And the reason behind that, it's coming from knowing what the key elements of better survival. This what we call the tree of life. And these hands represent each hand represents a survivor. And the roots, there are 10 roots here. Each color represents one of the key elements that causes and have been a reason for the improvement in the survivor over the last 30 years. So we have the responsive government policies. When it is available, it will definitely will help. A timely and accurate diagnosis, and the presence of effective treatment, the presence of multidisciplinary care, palliative and supportive care, family support, qualified workforce, teams available, and essential medicines. The presence of cancer registry and data, very important to know how things going on, and rehabilitation, reintegration of the survivors. Just mention about multidisciplinary care. Treating cancer, not anymore one-man show. It is a group of teams and members, and any weakness in that team will be affecting the whole care level of care. So we have the oncology team, doctors and nurses, surgical team, not only pediatric surgery, but we have ENT, we have ophthalmology, orthopedic as well, radiation team, and other pediatric specialties. We cannot care these kids without support of pediatric ICU, infection, as well as cardiology, GI, and respiratory and others, and also pediatric emergency service. Pathology and radiology are very important departments to help us for diagnosis as well for follow-up and monitoring these cases. And there has been for the last 20 years, there has been a major advances in the genetics and in the pathology. And that's why the role of pathology is very important in diagnosis. And there are other members, palliative team, the clinical pharmacist, child play therapist, and social worker. So all these members, once they are there, the care will be definitely of high quality. And in addition that, parents should be also member of this multidisciplinary team, because they are the one who will care for child most of the time at home, and they have to know all the details about and the importance of their observations as well. Supportive care, also one of the major causes of improving survival. For many years, there has been no changes maybe in medications, but improvement in the supportive care given for these patients has ended into a lot of improving of the survivor. And what we mean by supportive care, that having policies about the safety of chemo and reducing it, treating oncology emergencies is very important. There are several oncology emergencies that these patients may have. For example, fever, neutropenia, tumor lysis, mediastinal masses, spinal cord compression, or increased intracranial hemorrhage. So if we have a team who can manage these cases, definitely will help to reduce the mortality of these patients. Proper pain management, psychological support, nutrition as well. In addition, and this is very important, through even studies showing the presence of an NGO support, non-governmental organizations supporting and giving the psychosocial support for these patients. And we notice it over several years now, the satisfactions as well as the acceptance of the family and the children for this. It has been also helped with the presence of such organization. Just to give you an example of how multidisciplinary care can help, this child is 10 years old, who presented in 2020, I think it was 2020, during the era of COVID, with a history of cough and shortness of breath for 1 week duration, admitted in one hospital, a private hospital. And he was expected initially to have pneumonia with such X-ray, but there was concern with such widening of mediastina. That's why, because of that concern, they did a CT scan which showed a big mediastinal mass. And then we received that call. It was Thursday afternoon. Most of the difficult cases are coming usually in end of the week. I don't know, that's we notice it most of the time. And the patient arrived directly to the oncology unit in Salmania. And when we repeat the X-ray, That's what was the picture. This was just 2 days difference. And this is not surprise for a case of T-cell lymphoma. When they progress, almost the turnover of these cells, almost they multiply in size every 24 hours to 36 hours. So these patients, within 2 hours of admissions, he was seen by at least 5 subspecialties. In addition to the oncology, our service, we involve the PICU as well as the pediatric surgery, cardiology for echo, as well as the lab has been informed, and thoracic surgeons. And by next day, which was Friday morning, this patient underwent 5 procedures and under 1 GA. He was intubated electively, and we did for him intercostal drainage for the pleural effusions, as well open biopsy to be sure that we got proper enough tissue, in addition to lumbar puncture, bone marrow studies, and as well insertions of a central line. And he was started empirically on treatment with steroids as well. And he finished his treatment, which was for 3 years, almost 2.5 years, finished it almost now 15 months. He's in remission, alhamdulillah, and hopefully he will remain in that. Fact number 11, survival rate differ. Though we said that survivor is reached to 85 and above, but unfortunately, such survivor has been noticed to be what we call a pediatric cancer survivor gap. So that high survivor is belong to the high income countries, which are coming in the blue color. Though it's red here, but these countries are in the blue in the map, while those countries with low income countries and middle income, which coming in the red color and pink, that their survivor is, though is improved, but it is remaining far away from the current survivor. And that's what we call survivor gap. And when they studied that causes behind that, one of the main reasons is the delay or wrong diagnosis, or even lack of access to proper treatment. They have also the issues with treatment cost, because in many countries they have to pay. Alhamdulillah, in our country, it's free for patients. Treatment abandonment by some families because they are very poor, they are not understanding, or they thought that since they have a child with cancer, he's almost going to die. Weak health infrastructures, and also lack of awareness and information about such disease. So it's well known that early diagnosis meaning better survivor, and not only better survivor, but better quality of life. Because when such patients came in late or in advanced disease, there is a big burden of disease. So even for curable, highly curable diseases like lymphoma, retinoblastoma, Wilms, when they come with advanced stage, because of late on presentation or awareness, these patients will be exposed to highly toxic medication more than when they are for early stages, and that will expose them for more toxic death as well. Fact number 13 saying that childhood cancer cannot be prevented because we don't have a specific causes for it to prevent it. But it is well known that deaths from cancer can be reduced if cancer is detected early. And to detect early, we need two major elements. We need awareness of parents, so they can seek medical advice early if they have they are aware about these signs and symptoms and possibility that this could be a cancer, and awareness of doctors, so they initiate early workup and early referral to specialists, because it's well known that the eye does not see what the mind does not seek. So if they keep it in their mind, they definitely will do the work early. So a different scenarios, just to reflect you how awareness can help. This is a 3-year-old girl with this has been a real scenarios. We have seen it. 3-year-old girl presented to primary care with history of constipation for 2 weeks. The doctors went through history, and then you elaborate more on the causes of it, mainly related to diet and maybe or low fiber intake. So advised to give laxatives, and forget one important thing to do it: putting the hands on the abdomen of the child. Maybe he was busy, you know, in the health centers, they don't have enough time. But because also, if what happened, this patient, after 3 months, he presented with more distension abdomen, more worsening of constipation and pain, and he was found to have this big tumor originating from his kidney, and it was Wilms tumor. It was a stage 4, actually. It was metastasis to the lung. So if this patient was found to have this mass 3 months earlier when he presented with constipation, definitely he may have less or early stages which can be treated without exposing this child to radiation. Another child, 6 years old girl, presented with hypoactivity and reduced appetite of 1 month. She was found to be pale, no hepatosplenomegaly, no lymphadenopathy, and a finger prick test showed that her hemoglobin was 7. And because we know that iron deficiency is the most common, so I was given that impression that this child mostly having iron deficiency. That's why pale, and that's HB, and was given iron with a follow-up after 2 months. But this child came after 1 week or 10 days, presented to emergency with fever and was found to have low HP, low platelet, and very high count white blood cell, hyperleukocytosis with issues of tumor lysis as well. Another child, 14 years old, who had history of 1 year on and off of back pain, and with shopping from different medical consultations, thought related to his sport activities, given several courses of analgesia as well as physiotherapy. In addition, that a plain X-ray was done, it was normal. But at the end of the year, he started to have some neurological problems in his lower limb, and he was found at that time to have a spinal tumor. 12 years old girl with attacks of headache on and off of 3 months duration, with a positive family history of migraine, as well as also she was found to use her mobile a lot. Clinical examination was normal, no neurological deficit, and was given the impression that she has a migraine. But after several months, probably it was 5 or 4 months, this child, she started having more neurological deficit, and she was found to have a big tumor. It doesn't mean that any headache in children is a diagnosis of tumor, but should be concerned at least to do more examination, for example, to vision assessment, and also maybe a close follow-up to see if there is any changes in the examination. So systematic screening for childhood cancer is not practical and not cost effective. It may be practical, definitely for adults, as we know we have the breast cancer screening, because we have a population, well-defined population, and we have also a tools to be used for screening. But for children, though the number is not as big as an adult, but still we have many different types of cancer. And they found studies didn't show that screening will be practical, but actually they found that targeted programs promoting early identification and referral is the best among it. And accordingly, the WHO launched a global initiative for childhood cancer under the umbrella of early diagnosis and referral. Several years back, they started with the Child Cancer Smart and using this cartoons to show to be aware the whole countries about signs and symptoms, what we call it the warning sign or the red flag sign. And 2 years back started also to have another project, CDAR, Cancer Early Detection and Referral, by elaborating more on the common 6 highly curable type of cancers in children, which are acute lymphoblastic leukemia, Burkitt, lymphoma, Hodgkin, retinoblastoma, Wills tumor, and low-grade glioma. These represent almost 50 to 60% of all childhood cancer. And if detected early, definitely it is very highly curable. So elaborating and explaining about these diseases in a very simple to all levels of healthcare as well as to community will help to improve the survivor in low-income countries from below 30 to 60, at least to 60%. And also they found that it could help to save the life of 1 million by the next decade if they keep using that sort of project. And in fact, this is our project currently. We are planning to, for the coming 2 years, to cover these diseases as well, to improve the awareness with the aim of to, especially in our countries, alhamdulillah, it's a small country comparing, and this can be achieved through different levels at the primary as well as secondary and tertiary. The fact number 15 said, if cure is not possible, even so the goal of treatment at this level has to be changed from curative to the best quality of life for the child and family. And this is the basics of palliative care, which controlling any physical problem with the child, especially pain, and should be started early in the disease and maybe increase with time once there is the cure rate is coming less. And in addition to the psychosocial and spiritual support. In fact, palliative care is now becoming as a right of a child, as well as indicator of a good quality healthcare system. I just want to say that palliative care is not only specific for cancer, it can be given, it will be required by any diseases which has no curative, or any disease can end in death of the affected people. And in children, actually, if we go to palliative care, maybe only 10% of those who require palliative care are coming from cancer population, but the 90% from many other diseases. The journey of cure, this is the last fact. The journey of a cure is followed by a journey of survivors. And this is one of our survivors who had leukemia ALL in his early infancy. And then he relapsed actually after also, and but he went into second remission after getting the stem cell transplant more than 25 years. He is now, he graduated from university, and he is calling himself, I'm a fighter, and he is really a fighter. These people are heroes. They went through a lot of challenges to become a survivor and an effective member in the society. Why these patients are, we need to follow these patients because of the intensive treatment they got during their journey with cancer, exposing to high-dose chemo, radiation, probably bone marrow transplant, make them at risk to develop what we call late effect or late side effects, affecting their cognitive, psychological, hormonal, metabolic, fertility, as well as cardiac, pulmonary, and also making them at risk to develop second malignancy, probably 10 years from being off treatment. So for such patients, we need, they should be followed in what we call special clinics. We call it the long-term follow-up clinics, in order to detect any signs of second neoplasm and to keep advising them about avoiding environmental factors that increase their risk for a second cancer. And also, and because of that, also, the treatment now has been changed totally from giving treatment for cure at any cost to a treatment or to a risk-specific treatment in order to minimize exposing many children who can be cured with minimum intervention. So that's why we have different, for example, now leukemia ALL, we have 3 different groups, at least each group, according to the risk they have, we treat them with different intensity of treatment. So another question here, which day is the Cancer Survivor Day? First, Sunday or Friday? Sunday because in Western area, and Friday in Bahrain, of September, or in June? It's in June. So next June, hopefully, we are going to arrange for a big party celebrations of most of our graduated children who are survivors. We have more than probably 300 if we can catch them all, because many of them has become now an adult, and they are they are working, and they have their own families as well. So from all of that, what we want to know also about what we call a childhood cancer care pathway, from early detection to diagnosis to treatment and survivor care. And the aim of having such a journey, be aware about it, to know what factors can affect each one in order to give a safe, timely quality of childhood cancer care. To elaborate more on that, I just want to show you that cartoon. So we have from the onset of symptoms to the first medical seeking. This is what we call the patient time, or the presentation or pre-diagnosis, pre-symptoms interval. And actually, there are several factors affecting, but one of the major factors is awareness of parents, which make them to make this time shorter as possible from the time the child start having symptoms to be seen by in any medical area. And the time from first medical seeking to referral to the concerned people, we call it the referral time. And the aim also to minimize that time as short as possible. And the major factors that is affecting it is the presence of awareness of the physicians at all the levels, primary care, pediatrician, all other specialties, because such patients can present to different departments, can present to ENT, orthopedic, neurosurgeon, and also when having a good referral system. In Bahrain here, because again, it's a small country, we have currently the main center or unit to look after children with cancer is in Salmania. This is the Abdullah Kanu unit, we call it. And but over the last 1 year, another unit start to develop, but still under construction in Bahrain Oncology Center. And the main plan is to shift all these patients to one center, because the numbers doesn't require more than one units to treat these patients. And it's easy to approach the doctors in Salmania. We have currently 3 doctors consultant, and for any sick patients admitted, and there is need to refer him early, just direct contact with them. It will make to arrange the transfer of patients. For cold cases, we prefer also direct contact, and can contact also Dr. Dalal, which is working in Bahrain Oncology Center. The inpatient service, still we don't get it. We can't give treatment, but we can arrange for diagnosis workup in KHUH, as well as also giving them doing also surgical part. The time from diagnosis, referral to reach to a definite diagnosis, we call it diagnosis time. And this is definitely will be affected by the presence of MDT approach and the cost of treatment. And this is also applied for what we call treatment time. So the problem that in some diseases, we can see that the time from presentation, start of symptoms to the time of diagnosis, it may reach several months, and actually has been reported that maybe a year in some cases, especially those with a brain tumor. So our target is to minimize such duration. And honestly, just from a quick, small study we did it, we found that over the last 10 years, since we start actually with the help of societies, awareness of people. And sometimes we get parents who are telling the doctor, I have concern about my child, that this could be, because we learn about it, and please do workup. And we find that at least several patients has been diagnosed because of the concern of the parents. So how can we help these kids and their families? This is responsibility not only of the government or the health system in the country, but it's also the responsibility of all the people at level of individuals, at level of also private sections, companies, and or level of NGO. So when we talk about health system and the government, we need, there is always a need for improving the infrastructure and resources and personnel, develop a strong referral pathways to minimize the loss of these patients and early referral, and also accurate registry and the system. And we have, thanks God, we have a sort of that for pediatrics, at least I can say. It has been improved also for adults, especially with the presence of the National Tumor Board services. Improve education and training of health workers, and also encourage the new physicians and nurses to select this fields of treating patients with cancer, children with cancer, as a part of their career. It's not necessarily to be an oncology, but pathology, radiology, all the other services are important. Especially, we have noticed that there is a tendency to avoid such, to select such careers because it's difficulty, because whatever maybe the finance issues behind it, and because also the psycho burden of that issue specialty, and of course important of having palliative care program. From the other rules of everyone in community, any one of us, medical or non-medical, is raising the awareness and correct misconceptions of this disease. And having such activity, presentations, every one of you, you can even teach your family or people around you about these issues, having a high index of suspicion for early referral. Though we said that environment factors maybe not play major role, but if we teach our kids to follow a healthy life from their early in life, then that will make them less risk to develop cancer even in their later life. And we should start with ourselves also for them to learn. One of the things maybe I forgot to mention about the concern of the using of mobile and its association with cancer and the effect of electromagnetic field of these devices. There is always a concern about that. And there, some studies may support, but many studies also didn't support. And there was a recent study from Sweden. They said they didn't find associations, though I believe maybe more studies will come in the future, maybe showing it, especially with the tendency we notice of increasing also brain tumor all over. But even if these devices have no association with cancer, their association with other big medical problems and psychological and behavior attitude make a that force us to minimize using these devices and give it for our kids. The role of NGO as well is very important for education, supporting even research, and the help also for private section, because treating the devices for diagnosis, the medications are very expensive, as well as the needs for support, financial support for research is very important, and support survivors, because a lot of this, maybe they are exposed a lot of discrimination and wrong belief that most of them, they will die, and or they are the abnormal. Actually, many of them, we have seen them, they run a very safe life later. Actually, the experience of cancer has changed their life, making them good, strong persons, and they have objectives to help even others. And also support parents, especially during their journey, because they notice a lot of problems when they need to be with their kids in the treating centers, and maybe they get a lot of obstacles from leaving them from the work. So hopefully that sort of support will help them. So that's just one of the activities which we shared in 2022 with the Smile Initiative group, making a sort of awareness stands in city center with using brochures and leaflets in different language to improve this patient. And actually, it was very successful event in that time. Still, a lot of things can be given for these kids. So my take-home messages that remember that children are not small adults. Remember about the pathway of childhood cancer care, and the key elements of survival of children and through that tree of life, and the causes of survival gap and how we can help, and that through all hands at all levels, from individual, health system, government, non-government, that we can improve diagnosis, care, and cure of children with cancer, and close the survival gap. And even for those who doesn't have a curative disease, we can improve the quality of care for them as well. The last slides just about the theme of the International Childhood Cancer Day for 2024, and for the coming 2 years as well. It was coming under this theme, the better and equal access to care for all children and adolescents with cancer everywhere. Thank you very much for your attendance, and welcome for any question or comment.